Welcome to the Deep Dive, where we take a stack of information and extract the most important insights for you. Today, we're plunging into a topic that's, well, it's everywhere. Social media, news headlines, but with a twist we need to unpack. The surprising ways GLP-1 receptor agonists are impacting our skin. Drugs like Ozempic, Wegovy,
It
Mounjaro.
really is fascinating, isn't it? Because while everyone knows them for managing type 2 diabetes and, of course, weight loss, there's this whole emerging picture of their effects on the skin, some good, some not so good.
Uh,
So our mission today is to really dig into that. We're looking at systematic reviews, cross-sectional studies, case reports published just this year. We've got data from PubMed Central, analyses of FDA adverse event reports. It's quite a lot.
Okay, so lots to get through. We'll explore everything from those aesthetic changes people talk so much about online to their potential in actually treating some tough chronic skin conditions.
Exactly. You might be surprised where this leads.
All right, let's start with the basics then. For anyone listening who isn't maybe deep in the weeds on this, what exactly are GLP-1 agonists? How do they work?
Sure. So, at their core, they're medications designed to mimic a natural hormone your body makes called GLP-1, glucagon-like peptide 1. It's made in your gut.
Okay.
And this hormone is a real multitasker. It helps manage blood sugar, tells your brain you're full, so it regulates appetite, and it even supports heart health.
Hmm.
So when you take a GLP-1 agonist, it activates the same receptors this hormone uses. These receptors are, well, they're in your pancreas, brain, gut. Turns out they're even in the skin, which we'll get to.
Oh, okay.
And activating them does a few key things. Boosts insulin when your sugar is high, lowers glucagon, another hormone that raises sugar, slows down how fast your stomach empties.
Ah, so that's the feeling full part.
That's a big part of it, yes. And ultimately, it suppresses appetite.
So it's really doing a lot more systemically than just controlling blood sugar for diabetes.
Yeah. Oh, absolutely. I mean, yes, they're excellent for glycemic control and type 2 diabetes. That was the original main focus. But the significant weight loss they can cause, that's what really pushed them into the public spotlight.
Right.
Some studies are even suggesting they might be an alternative to bariatric surgery for some people. And then you've got the proven cardiovascular benefits, reducing heart attack and stroke risk. Plus, newer evidence points towards kidney protection, too.
Wow, okay. That's a really versatile class of drugs then.
It really is.
And how are they typically taken? I know there are different forms out there now,
Yeah, initially, almost all of them were injections, a subcutaneous shot.
like insulin.
Similar idea, yes. But things are moving fast. In 2019, we got oral semaglutide, which is Rybelsus.
Hmm.
It's a pill form that uses a special enhancer molecule to help it get absorbed.
Okay, a pill version, that's a big step.
Huge for convenience. And looking even further out, there's some really interesting preclinical work on things like transdermal microneedle patches. The Hero Patch system is one example.
So like a patch you wear, no needles.
Potentially, yeah. It could be a needle-free way to deliver the drug, maybe even reduce some of those injection site issues we'll talk about. Still early days for that, though.
Fascinating. Okay, so we have these powerful drugs with growing uses and evolving delivery methods. Let's really zero in now on the skin connection.
Right.
This term Ozempic face
Mm-hmm.
is blown up online. What is that exactly?
Yeah.
Is it, a real medically recognized thing?
It's definitely a real phenomenon, yes. But Ozempic face is more of a colloquial or media term. It's important to stress it's not specific just to Ozempic.
Got it.
It can happen with any rapid, significant weight loss, including the kind people get from these GLP-1 agonists. What people are describing is that sort of gaunt, maybe aged look.
Hollowed cheeks, maybe?
Exactly. Hollowed cheeks, eyes might look more sunken, maybe some sagging around the jowls, wrinkles appearing more prominent. It's because you lose that subcutaneous fat layer in your face.
So the drug isn't targeting facial fat specifically. It's just overall fat loss showing up there.
Precisely. It's a consequence of systemic fat reduction. The face just happens to be a place where volume loss is very noticeable and can change your appearance quite dramatically.
So it's almost like the signs of aging, but happening really quickly because of the fast weight loss.
That's a good way to put it. It mimics some aspects of aging, the volume loss, the laxity, but it's compressed into a much shorter time frame because the underlying support structure, the fat, diminishes rapidly.
And are people seeking treatments for this?
Oh, definitely. Dermatologists and cosmetic surgeons are seeing a real surge in consultations for it.
What kind of things are being done?
Well, it ranges. People are looking at dermal fillers to replace the lost volume, things called biostimulatory agents to try and get the skin to produce more collagen,
Oh,
skin tightening procedures using heat or ultrasound, and then more invasive options too, like surgical facelifts or even fat grafting, taking fat from elsewhere in the body and putting it back into the face.
that sounds complex. Does the fat come back normally if someone stops the drug and regains weight?
That's the tricky part. It might not return in the same way. The distribution could be different. So the takeaway really is about managing the rate of weight loss. Trying to avoid excessive super rapid loss might help preserve some of that natural facial fat. And that fat isn't just cosmetic, it has biological roles, contains stem cells. It's important.
Okay, that's a really significant aesthetic consideration.
Yeah.
But moving beyond the cosmetic side, what about other, maybe more common skin problems people might encounter with these drugs?
Yes, and this is really important for awareness. Our sources, especially looking at that FDA Adverse Event Reporting System, ARE data, well, it showed a huge jump in reported skin issues.
How big a jump?
Like 186% increase from 2022 to 2023. And of all the adverse events reported for GLP-1s in that time, over 6% were dermatological.
Wow.
Liraglutide and semaglutide were the ones mentioned most often in those reports.
Like 186% that's a lot. So if someone's listening and they're on these meds, what are the main skin things they should maybe watch out for, the sort of top hits from that data?
Right. The most commonly reported things were, number one, rash. Then pruritus, which is just the medical term for itching.
Okay.
Then alopecia, that's hair loss. Urticaria, which most people know as hives. And finally, hyperhidrosis, meaning excessive sweating. Those were the top five.
Hair loss, that's one that always gets people's attention.
Mhm.
Is that a direct effect of the drug on the hair, or is it more related to the weight loss itself?
That's still being figured out, honestly. It's likely complex. Often it looks like telogen effluvium.
Which is?
It's basically stress-induced shedding. Big physiological changes like rapid weight loss can trigger it. So that's definitely a suspect, especially with semaglutide and tirzepatide where it's been reported more. Nutritional deficiencies tied to the weight loss could also play a role.
Right.
But can we completely rule out a direct effect of the drug on the hair follicles? Not yet. More research is needed there.
Got it. And what about problems right where the shot goes in for the injectable ones?
Yeah, injection site reactions are actually the most frequently reported skin issue overall.
What does that look like?
It can be redness, swelling, maybe tenderness, sometimes little bumps or nodules under the skin. Occasionally, people report lipodystrophy that's like a dent from fat loss or sometimes a lump from fat gain right at the injection spot.
Mm.
Exenatide, especially the once-a-week version, seems to have higher rates of these compared to some others. It really highlights why proper injection technique and rotating your spots is so important.
Definitely. Okay, those sound mostly like nuisances, maybe distressing like the hair loss. But are there more serious, even if rarer, skin reactions people need to be aware of?
Unfortunately, yes. While much less common, more severe things can happen. You can get systemic hypersensitivity reactions, basically allergic reactions. These can range from widespread rashes
Uh-huh.
to very rarely anaphylaxis, which is obviously life-threatening. Liraglutide has been linked in some reports to something called generalized xanthomatous pustulosis. That's a nasty rat with lots of little pus bumps.
Yep.
And there are also these rare but concerning case reports linking GLP-1s to autoimmune blistering diseases like bullous pemphigoid.
Where you get big blisters.
Exactly. Big, tense blisters. And even rarer things like pyoderma gangrenosum, which causes painful skin ulcers, or leukocytoclastic vasculitis, inflammation of small blood vessels. So the bottom line is any new, weird, or severe skin change needs checking out by a doctor. Vigilance is key.
Absolutely. And you mentioned altered skin sensations earlier, too. What's that about?
Yeah, things like dysesthesia, which is like an unpleasant, abnormal feeling on the skin. Paresthesia, tingling, pins and needles. Hyperesthesia, where things feel overly sensitive. Or just burning sensations. About 2–3% of people on the oral semaglutide reported something like this. Why it happens isn't totally clear. Maybe indirect effects on nerves, maybe changes from fat shifting around quickly, maybe something with tiny blood vessels in the skin. Theories, but no firm answers yet.
So, okay, we've covered the downsides, the aesthetic changes, the common reactions, the rarer, serious ones. It's a lot. But now let's flip the coin, because this is where it gets really unexpected, right? These drugs might actually help some skin conditions.
Yeah, this is where the story gets incredibly interesting, yes. Because despite those adverse effects, GLP-1 agonists are showing real therapeutic promise in several areas of dermatology. And often it seems to be separate from just losing weight or controlling blood sugar.
Okay, like what? You mentioned wound healing earlier. That sounds potentially huge, especially for diabetics.
It really is. Studies have shown they can enhance wound healing, and importantly, not just in diabetics, but also in mice without diabetes, suggesting it's not just about better blood sugar.
How do they do that?
They seem to promote the migration of keratinocytes. Those are the main cells in your outer skin layer needed to close a wound. They boost angiogenesis, which is new blood vessel formation, vital for bringing nutrients. And they stimulate fibroblasts, the cells that make connective tissue.
So faster healing.
Essentially, yes, accelerated wound closure. There was even one study using liraglutide combined with zinc oxide in a special dressing, and they worked together synergistically to improve healing even more.
Wow. Okay, that's impressive. What about those chronic inflammatory conditions like psoriasis? So many people struggle with that.
Psoriasis is a really exciting area here. We know psoriasis is often linked with metabolic syndrome, obesity,
Right.
and interestingly, researchers found that GLP-1 receptors, the very things these drugs target, are actually present in higher levels right in psoriasis plaques.
So the drug has a direct place to act within the lesion.
It suggests that, yes. And studies show these agonists have direct anti-inflammatory effects. They can reduce key inflammatory signals like TNF-alpha and IL-17, which are major drivers of psoriasis. They can block certain signaling pathways involved in inflammation and even decrease the thickness of the epidermis, which is characteristic of psoriasis.
And are we seeing this translate into results for patients?
We are. Clinical trials and quite a few case reports show significant improvements. People on semaglutide or liraglutide seeing their PSI scores, that's a measure of psoriasis severity, go down, and their DLQI scores, quality of life, go up. And notably, some of these improvements happened before major weight loss kicked in.
Suggesting it's not just the weight loss helping.
Exactly. It points strongly towards a direct effect on the immune system or the skin itself.
That's really promising.
Yeah.
But I feel like I've also seen reports going the other way. Maybe psoriasis getting worse sometimes.
You're absolutely right to bring that up. It's not straightforward for everyone. While many studies show benefit, there are isolated case reports where psoriasis seemed to flare up or worsen.
Oh.
And there was one randomized trial in patients without glucose intolerance that didn't find a significant improvement in their psoriasis. This might mean the benefits are stronger if you do have those metabolic issues, or maybe some benefit comes indirectly from better blood sugar control in diabetics.
So it's complicated.
It really highlights the complexity, yes.
Yeah.
Individual responses vary. We need more research to figure out who is most likely to benefit and why some people might have the opposite reaction. It points towards needing a more personalized approach.
Makes sense. What about hidradenitis suppurativa, HS? Another really tough chronic inflammatory skin disease.
HS is another condition closely linked with obesity and inflammation, and yes, it's also showing promise with GLP-1s. Case reports describe patients having fewer inflammatory nodules and abscesses and just generally less severe disease.
Again, is that weight loss or direct effect?
Likely both. Similar to psoriasis, the weight loss definitely helps reduce the overall inflammatory load from fat tissue, but the drug's ability to lower those same inflammatory signals like IL-17 and TNF-alpha is thought to play a direct role too.
But potentially flares here too.
Yes, just like with psoriasis, there are reports of some individuals experiencing HS flares while on the medication. Again, it underscores that individual immune responses can differ, and we need to understand that better.
Okay. Are there any other, maybe less common skin conditions where these drugs are being looked at?
There's some early exploratory research, conditions like lichen planopilaris, which is a type of scarring hair loss, and Haley disease, a rare genetic condition causing blisters and erosions. The idea is that the anti-inflammatory and metabolic effects might be helpful. For Haley, there was one specific case report showing significant improvement with liraglutide, and they linked it to lower levels of IL-17 and IL-6. So potential there, but very early days.
So we've gone through this whole spectrum, the good, the bad, the surprising. What's the bottom line for listeners? If you're considering these drugs or already taking them, what should you take away from all this?
I think the main thing is awareness and careful monitoring. That's key. If you're a doctor prescribing these, it's really crucial to talk to your patients about this whole range of possible skin effects, the side effects, and the potential benefit.
Managing expectations.
Exactly. And for you, the patient, it's important to understand these are usually chronic medications. You stay on them long term. And also be aware of body composition changes. You lose fat, but you can lose muscle too if you're not careful with nutrition and exercise. That's part of the bigger picture.
And what about those concerns you hear sometimes about GLP-1s being maybe overhyped or used when they shouldn't be? How do we view that?
Yeah, it's a real balancing act. For people with diagnosed type 2 diabetes or obesity that meets medical criteria, these drugs can be genuinely life-changing. The benefits are substantial.
Right.
But the intense media buzz, the social media trends, it does lead to some overhyping and sometimes off-label use for maybe just minor weight loss. And that can, unfortunately, lead to shortages for the people who have a clear medical need.
So stick to approved uses.
Absolutely. Stick to FDA-approved products, work closely with your healthcare provider, make sure it's the right choice for your specific health situation.
Okay. And one really important safety question people might have, is there any link between taking these drugs and getting skin cancer?
That's a critical question, and thankfully, we had some reassuring data now.
Yeah.
A large, recent population-based study looked specifically at this. They found no increased risk of melanoma or non-melanoma skin cancer in people using GLP-1 agonists compared to those using other diabetes drugs. So that's very positive news.
That is good to hear.
What about the really rare but perhaps more serious complications? Anything people should be particularly aware of?
That's a really important question. So regarding serious risks, while they are infrequent, there have been observations of thyroid C-cell hyperplasia. That's like an increase in certain thyroid cells.
Okay.
And rodent studies did show a potential risk for medullary thyroid carcinoma. It's crucial context.
A type of thyroid cancer.
Yes. And it's important to note the FDA report specifically lists thyroid cancer as a reported adverse reaction for semaglutide. So while rare, it's definitely something requiring vigilance. You absolutely need to discuss any personal or family history of thyroid issues with your doctor before starting these medications. So looking ahead then, what's next in this whole field of GLP-1s and the skin? Where does the research need to go?
Well, a big focus needs to be on really nailing down the mechanisms. Why exactly do these skin changes happen, both the good and the bad? We need to understand that better at a molecular level.
Okay.
Identifying biomarkers would be huge. Imagine if we could predict who's likely to get severe side effects or who's likely to see their psoriasis clear up dramatically. That would allow for much more personalized treatment.
Right, targeting the therapy.
Exactly. And we definitely need more long-term safety data, especially regarding those aesthetic changes like the facial fat loss. What does that look like after 5, 10 years on medication? We need to know.
And delivery methods.
Yes, continuing to develop alternatives like those patches could make a big difference. Fewer injection site issues, maybe better adherence for patients. That's definitely an important avenue.
Personalized medicine really does seem to be the future here.
Absolutely.
Well, this deep dive has certainly shown that GLP-1 agonists are way more complex than just being simple weight loss shots. Their impact on the skin is profound and really varied, from those cosmetic concerns about Ozempic face all the way to potentially treating really difficult conditions like psoriasis and HS.
Indeed. It really underscores how the skin, our largest organ, often mirrors what's happening inside metabolically. Understanding these drug interactions gives us this unique window into the connections between our metabolism, our immune system, and our overall health.
It really makes you think, doesn't it? And as we learn more about these incredibly powerful medications, here's a final thought for you, the listener, to chew on. Could our skin, with all its complexities that we've just discussed, become an even more direct window, maybe even a primary target, for managing our systemic metabolic health down the line?
Something to consider, definitely.
Thanks for joining us on this deep dive. We hope you feel a bit more informed, maybe a lot more curious about the surprising and evolving world of GLP-1 agonists and your skin.